Okay.
Well, thank you very much indeed to Dr. Francesco Riva for preparing that opening video for us. Dr. Riva is with us, and thank you very much indeed. Hello to everybody, everybody here in Rome, to the journalists who are here, and also to everybody who is following online. We know that we've got 700 people who'd registered for this event online. Probably not all of you are there, but it's great to think that there's so much interest in what we're going to be talking about today. And look, I've opened this package because this is a bit of a clue to what we're talking about today. It's going to be hard for you to see this online. I realize that, but for in the room, you can probably see that this is FilmTec, which is a very, very thin strip, an orodispersible film, no need for water, dissolves in the mouth, perfect for children, for elderly people, for anybody who has problems swallowing, but for everybody really, and huge potential for the delivery of food supplements, for vitamins, but also for pharmaceutical ingredients. Now, the first vitamin that's being launched on the market and has been launched in some countries by IBSA is vitamin D. And really, so we want to really just get talk a lot more about vitamin D today, find out how important vitamin D is for our health and also our immune systems, because of course, in the times of COVID, immune systems come very much to the fore. We're hearing new research also that looks at the role that vitamin D is playing in sport, and that's really interesting to hear. So let me introduce our panel of experts, and then we're going to hear from each one of them. Just to let you know that obviously in the room you can ask questions. We have a half an hour at the end, which will be for questions and answers. We will have a microphone in the room. For people watching online, please send your questions via the chat in the Zoom, and we will get to as many of the questions as we can. So let me introduce our speakers. We have Professor Silvia Migliaccio, who is from the Foro Italico University here in Rome and president of the Italian Society of Food Scientists. Dr. Tiziano Fossati, who is the head of pharmaceutical R&D for IBSA. Next to him is Professor Philip Calder, Professor of Nutritional Immunology within Medicine at the University of Southampton, that's in the UK. This side of the table, Jean-Yves Regenster, Professor Specialist in Musculoskeletal Health and Aging at the University of Liège in Belgium, and Dr. Daniel Owens from the Liverpool John Moores University, a specialist in sport and exercise science, and Dr. Francesco Riva. So let us begin now. Professor Migliaccio. You're the president of the Italian Society of Food Scientists. You're from the Foro Italico University of Rome. So we're talking about FilmTec being used primarily for food supplements at the moment. So maybe you can give us a sense of how important food supplements are and how important it is that pharmaceutical companies really sort of help to deliver these supplements in the most efficient form.
Good afternoon. I don't know if microphone works. Good afternoon to everybody. Thanks to Professor Riva for the involvement in this simulating afternoon, and thanks to IBSA to organizing this interesting afternoon and for inviting me. Yes, my task today, as Katia has mentioned, is to give somehow a brief introduction and share with you some important concepts regarding good health, and then when or why supplementation might be needed. And when, and without wasting time, let me just remind you that when we speak about good health, these terms somehow defines the care of the human body and everything which can be done to maintain wellness, prevent metabolic chronic diseases, and protect it from sickness, obviously, and intoxication, and also to take care in some way to enable access of the cure. We can somehow, if we ask ourselves who somehow started to talk about good health, we can recognize in Hippocrates, of course, the first physician who talked and who mentioned good health with his opera, which was written by him, which is a regimen of life, dieta in Greek, dieta, as we say in Italian, with which he gave important indication to the citizens at that time regarding the factors and important indication to maintain good health. And when he described these important factors, he mentioned obviously nutrition as an adequate and good nutrition could help and be an important pivotal factor in maintaining good health, adequate physical activity personalized for each individual, and then last but not least also wellness of the mind. Obviously, there is no time to talk about all these factors, and I would like to concentrate your attention on nutrition. And when we speak about nutrition, we have to remind that when we speak about nutrition, we talk about food, and we introduce food in our body, eating obviously food. And the important point is that food contains nutrients, and nutrients are substances, molecules somehow, with specific tasks in our body. And the nutrients contribute to the maintenance of growth, of health, homeostasis of our tissue and organs, and then to the maintenance of wellness. When we talk about nutrients, we can divide them in macronutrients, which we can recognize in glucid or carbohydrates, lipids or fat, and proteins, which we eat sufficiently, at least at our latitudes. But then another important factor which sometimes we forget about is the micronutrients, which are minerals and vitamins. And when we think about vitamins and minerals, we have to think that we introduce them in small amounts as compared to the macronutrients, but nevertheless, we do not have to forget that they play important role, as I mentioned before. Obviously, when we talk about introducing the nutrients in our food, we have to remember that we do not have to introduce these nutrients in a random manner, but these nutrients, as is somehow displayed in the slides, have to be introduced in specific pattern. Going back, obviously, to Greek, to the Mediterranean Sea, whatever, the best concentration, the best diet model pattern to introduce nutrients is the so-called Mediterranean model, which, as you know, has thousands of literature, scientific work, which demonstrate the importance of this type of nutritional pattern in the maintenance of wellness, good health of our body, and also the prevention of metabolic disease, and has been recognized several years ago by UNESCO as immaterial heritage of humanity. So you can figure it out how important it is. But what is important, I would like to focus your attention on, is the fact that, as depicted in the slides, these nutrients need to be introduced in specific manner. Obviously, we usually use percent to display and to describe the macronutrients, but then we often forget vitamins and minerals, but nevertheless, they're quite important. When we talk about nutrients, we forget other things, is that we think that the introduction of nutrients with food is sufficient. But we have to remember that one important point is that the bioavailability and bioaccessibility of the dietary compounds, so the nutrients, then they are introduced. Why? Because quite often when we introduce nutrients, there might be some environmental factor which might somehow be interfering in the complete or optimal absorption of those nutrients in our body. And then here, the bioaccessibility can then be interfered by several factors. And thus, what it happens that the bioactivity of specific nutrients is then somehow affected, and then we might not have an optimal level of these factors. Then going to the somehow important topic of this afternoon, let's have a look of one important nutrient, which is vitamin D, that we know play important roles, and we will hear later on. I won't speak about this one, but I would just like to remind the vitamin D metabolism, which is quite important. And we know that vitamin D is produced by our body, is produced at the level of our skin under the effect of UV light. And this is the majority of vitamin D in our body. However, what it happens that we can introduce vitamin D also through diet and supplements. What does happen then in our body is that vitamin D undergoes a series of biochemical steps which lead to the production of the active form of vitamin D. As you can see in this part of the slides, there are depicted some of the foods that contain vitamin D, and then we can then absorb vitamin D also food. One important point though to remember is that unfortunately there are several environmental factors, interfering factors, which lead to a not optimal level of vitamin D in our body, or to the fact that vitamin D introduced in our body through food might not be sufficient. So what it happened that we might need to supplement, to introduce somehow to optimize the level of vitamin D in other manner. So when is supplementation? This is the question that we somehow can pose ourselves. Well, let's see some of the population who might need specific vitamin D supplementation here. This is a woman, an osteoporotic woman, and old osteoporotic woman, and you can recognize somehow by the kyphosis that this woman has undergone, unfortunately, several vertebral fractures. And she's old. You can appreciate the skin that is somehow age, obviously, with the woman herself. So the production of vitamin D for sure is not sufficient. Since she's not healthy, she might have a decrease of production of vitamin D in the skin. So this is for sure a person who needs vitamin D supplementation. Who else? For sure, this woman, we can say this in a good health. However, the optimization of vitamin D level might be needed also in this woman as well. She's healthy, she performs for vitamin D activity, but we know that, and we will hear later, that also muscle function can be more modulated by vitamin D. So it's important to maintain a good level of vitamin D in this woman as well. What else? Well, children is a population who is growing. Vitamin D, we know, play an important role in the growing process. And so even though this child drinks milk and is drinking milk, so he might introduce vitamin D through milk, the level might not be sufficient. So this is another population who might need the vitamin D supplementation. And this is another population that we have to keep an eye on. These are people affected by overweight or by obesity. And we know now that this population is a population who has a low level of vitamin D. So this is a population that we have often to supplement. And then last but not least, the healthy individual, people who play sports at their agonistic level or not agonistic level, and they might need, we will hear later on, they might need vitamin D supplementation as well. So these are some population, and let me share with you some of our results just to have somehow to visualize what we mean or what when we talk about vitamin D decreased level, for instance, in a population at risk, as I mentioned before, as obese people. This is a study we published several years ago. I would like to focus you only on the last line. And this, you see, there are people, different people, young people. These are people in the fourth decade of their life. These are women, but the results are the same women of men. And you can see that increasing the BMI, so increasing the rate of obesity, there is a decrease, significant decrease of vitamin D level. So this is an important point that we have to keep in mind. So that's what I mean when we say that some population might be at higher risk. So how we can somehow supplement this population, which could be the best way? Well, there are several formulations of vitamin D, and we now know that a good manner to optimize the absorption could be the sublingual manners, because we know that the sublingual microenvironment is quite irritated, and so there is a fast absorption of vitamin D, and so this is an important point. And then what it might happen if when we use one pattern of sub-administration instead of another one. Well, for instance, this pattern can give us a faster absorption, and it might bypass liver first pass metabolism. And you have observed in the slide I showed you before that vitamin D metabolic pathway undergoes several different steps, and so there might be environmental factors which might actually interfere. So that's another important point that we have to somehow keep in mind. And then Obviously, research has focused on new formulation. Research is growing, and pharmacological research is growing not only in finding new molecules for curing or for preventing disease, but also to optimize, as I mentioned before, when I talk about bioavailability, biodisponibility, the absorption of specific molecules. So as you can appreciate here, there has been evolution of our formulation, and this obviously to optimize the efficacy. So somehow here is depicted a history of different supplementation. We might have or might use tablets, film coated tablets, pills, granulate, or somehow since this pattern, this way of taking other supplements, medicine, whatever, might create some difficulties in some specific individual. Now the innovation has somehow given us, has improved, has given us new formulation. And the innovation is the orodispersible formulation, which somehow can improve the absorption, as I mentioned before, but also can help to improve patient's compliance, because quite often we forget the compliance of the patient is very important. If a patient has difficulty in swallowing a pill, obviously that person won't take the pill many more times. So he will take once. Well, the doctor told me to take second one, but then he or she will stop. And so this new formulation might help as physician in optimizing also and in personalized therapy. So I finish here, and I will thank you for your attention. And what this somehow cartoon say, that maybe we need some vitamin D to cheer up and also to maintain good health. Thanks.
Thank you very much indeed. Yes, vitamin D to cheer us up. So you talked about the importance of vitamin D there, and also the importance of bioavailability, and mentioned the different formulations, which will lead us nicely on now to hearing from Dr. Tiziana Fossati, Head of R&D from the pharmaceutical department at IBSA. So tell us some more about the development of FilmTec and where you see, I mean, this is complex technology, I think we're talking about, and where you see the potential for the future.
Thank you, Katie. Thank you for everybody, and good afternoon. So I will speak about the pharmaceutical technology and how orodispersible film, and in particularly vitamin D, was invented and developed. So what does it pharmaceutical technology means? We start from the origin. The origin of the pharmaceutical technology is around 2000 years ago, during the Roman Empire, where Claudius Galenus make the first preparation based on natural products, but he started to mix these natural products in order to have a more appropriate formulation to apply to the different healings. And of course, coming up to nowadays, in which the pharmaceutical technology is scientifically based, and the application of the scientific knowledge and the technological know-how help the pharmaceutical, of course, development and the industry. What does it means, pharmaceutical know-how? We can now, to study the optimized formulation, we have means to improve the manufacturing process, so the industrialization of the product. We have also very, very important in vitro models to predict what will happen in vivo. And this is an important point in order to check not few, but many different formulations, many different preparations. Of course, big improvement also with the protective packaging to help the stability, to help the goodness of the product up to the end of shelf life. Quality checks. Quality control is one of the main points for the pharmaceutical-oriented company, and up to the personalized medicine, so the best product for the patient. How pharmaceutical technology can be smart? So, summarizing what I just told, we can imagine and predict and plan the strategic formulation in order to improve the drug delivery using the cutting-edge technologies. we have to think and to develop the high performance processes, high performance manufacturing, using appropriate raw materials. This is a very important point because the quality of the final product depends strictly from the quality of the raw materials used to prepare the product. As told, the right packaging. So the packaging has to be easy but highly protective, and we can reach with all these elements the therapeutical target, and to focus the attention to the patient needs. This is the starting point. So during the development, mainly at the beginning of the development, the product is designed. So we think about the scientist, think about how to design the product, and what are the needs of the patient. So sometimes I am a patient, so thinking about what are the patient wishes, I would like to have effective medicine, a pleasant taste, why not? Friendly use, so easy to use, acceptable swallowing barriers, ecologically sustainable. It became more important in the recent year. I have to perceive quality, and the product should be reliable. What is the scientific view? So what are thinking scientists when they plan to develop a new product? So the scientists think about patient compliance, high quality of the product, easy administration. Oral administration may be without water, without big tablets, without barriers. Sustainable bioavailability, suitable bioavailability, robust industrial process in order to have the consistency of the production. Every working batch has to be the same, every dose has to be the same to the other. So the process must be standard, precise dosing, and tamper-proof. How plan the product development? So first point is the compliance of the patient. Compliance means there are many terms or many ways to describe the compliance. I like to describe as the extent to which a person behavior coincides with medical or healthy advice. Then in the choice of which is the best formulation, of course, the scientist has to ask if the active ingredient is suitable for liquid, solid, or other type of formulation. Is the active ingredient suitable for oral or topical or injectable administration in order to have the good bioavailability? How can be assured the stability for the whole shelf life? So the product has to be the same up to the end of up to the expiry date. Which are the characteristics that better meets the patient need? We are speaking today about the new innovative oral dispersible films. FilmTec is a technology behind the oral dispersible film. Oral dispersible films are described from European Pharmacopoeia as a single multi-layered sheet of suitable material to be placed in the mouth, where they dissolve very rapidly. Oral dispersible film require only a small amount of saliva to dissolve, and water is not necessary. So we can say anywhere and at any time. This improves the compliance of the patient. Which are the main components of the oral dispersible film? So there is the active ingredient that can be a pharmaceutical product, or can be, of course, the food supplement. And many other components, but the main base is maltodextrin. This is our patented innovative component that is very good film former. He has a good solubility in water. It is based practically on glucose, so it is a very simple also food product. Of course, for the pharmaceutical, we have a high quality maltodextrin, safe, odorless, gluten-free. European Pharmacopoeia is the basis. What are the advantages of the maltodextrin? In these photos, you can see the film before the solution, and then in few seconds, only putting in water, it dissolves, disaggregate and dissolve very rapidly, very rapidly. This happens with our saliva when we take in our mouth. FilmTec manufacturing. So I think I don't have time to describe in detail all the passages, but a liquid dispersion is prepared, the mixture is spread on a support, the support is dried to form this very, very thin layer of maltodextrin, and then the rolls are cut in reels, and then every dose is very precise due to the dimension of the single film. Which are the application of this platform, because oral dispersible film and the FilmTec is in reality a platform. There are many products, pharmaceutical products that can be put inside the oral dispersible film. They are food supplement like vitamins, melatonin, and many other products that can be put. And so I can say it is very practical, small, dissolving in few seconds, precise dosing, great compliance in all subjects, including, of course, where applicable for elderly people, for young children, gluten-free and lactose-free. So our pharmaceutical technology can be smart through an innovative approach focusing on patient needs. And only few seconds to show you how easy it is to take. This is the film, and of course, you can take without touching it. Thank you very much.
Can I just ask you, Tiziana, before you sit down, why, I mean, I know that any food supplements, more or less, or pharmaceutical ingredients could be used with this technology. So, but why are you concentrating on vitamin D as one of your first products?
Yeah, it is not in reality the very, very first product. We have some other pharmaceutical product, and we focus the attention before, because we are a pharmaceutical company. So we focus the attention before on pharmaceutical products. I cannot mention, of course, because they are drugs. And then with the supplement. Vitamins are perfect for the film because they are given in a very small amount. So the active ingredient or the component is small, and so it can be contained in this very thin or dispersible film. But the amount that can be put is suitable for many, many, many other compounds, food supplement or drugs. Active ingredients.
Thank you very much. What did it taste like, by the way?
Orange.
Orange. Thank you so much. So let's hear now from Professor Philip Calder, Professor of Nutritional Immunology within Medicine at the University of Southampton in the UK, to get us a sense of the importance of the role of vitamins, and particularly vitamin D in our diet. And I know that we do not, a lot of us, we've already heard, do not have high enough levels of vitamin D, do we, in our bodies?
Yes. So that's one of the points I'm going to make, Kathy. So thanks very much. It's great to be here. I think my talk links up a little bit of particularly what Sylvia has said with what Jean-Yves and Daniel are going to focus on with vitamin D. So I'm a sort of a bridge. I don't have a live demonstration, I'm sorry, so I can't keep up with that. So it's really about the general role of vitamins in our health. So the word vitamin is actually a contraction of this term vital amine that was first used in 1912. Vitamins are chemical entities. They're essential for the function of every cell in our body. So every cell needs probably all of the different vitamins. They're involved in probably thousands of different metabolic reactions in our cells, usually as cofactors, that is, factors that give those reactions a helping hand. So they make those reactions work better or more favorably. As a result of this role in metabolism, vitamins are required for the normal function of the body. So they fit very much with Sylvia's idea around maintaining our health and well-being. Most vitamins can't be made in our bodies, so they're essential to us, to our function, but they have to come from the diet. And this is actually the definition of an essential nutrient, that it's a nutrient which is required by our body but can't be made by our body. Okay, so almost all vitamins are, strictly speaking, essential nutrients. We have to eat them. Vitamin D is actually an exception, at least in theory, because we can make vitamin D in certain amounts, as you've already heard and as you're going to hear several times hereafter. We have two general forms of vitamins. We have the fat-soluble and the water-soluble vitamins. That's simply a feature of their structure. So the fat-soluble vitamins are A, D, E, and K, and the water-soluble vitamins are all of the B vitamins, vitamin C, which for some reason I missed off of here, niacin, pantothenic acid, and some others like biotin. Okay. Vitamins are really important scientifically, and it's, I think, amazing that in the period of the first half of the 20th century, vitamins were seen to be so important that they were the subject of at least 13 Nobel Prizes. So these are amongst the most important scientific discoveries in physiology or medicine. As I mentioned, vitamins are essential to the function of every cell in the body. And what that means is if we don't eat, if we don't consume enough of any given vitamin, our cells don't work so well and we get disease as a result of that. So in other words, vitamin deficiency causes disease. And you can prevent those diseases by giving people vitamins, and you can even treat most of them by giving the deficient individuals vitamins. So here are vitamins, fat and water-soluble vitamins, and the diseases that their deficiency causes. Of course, the most commonly known one is vitamin C and scurvy, but also vitamin D deficiency causes rickets in children, and the same disease in adults. It just has a different name, osteomalacia. You'll also be familiar perhaps with some of the things also on here. For example, folate deficiency causes neural tube defects in newborn children. So if we don't get enough of these vitamins, we have a frank disease that can be treated with the deficient vitamin. As a result of that, everywhere in the world, there are recommendations for daily intake of all of the vitamins, or each of the vitamins, okay? And these recommendations are based on the amount that's needed to avoid deficiency. In other words, to stop those deficiency diseases from happening. Obviously, it's important that people's diets provide enough vitamins, but we know from surveys that many people don't meet the recommendations for a lot of vitamins from their diet. Some countries have really very good survey data on people's dietary intakes. This is data that comes from surveys in Germany and the United Kingdom. And what's shown here in a traffic light system is the percent of people who are not meeting the recommended intake for each of the vitamins that's listed here. So if this is vitamin D here in adult men and women, you see all the other vitamins listed across here, both fat soluble, water soluble. And if the traffic light is red, that means that more than 3/4 of the people in the population are not meeting the recommendation. So in both Germany and the UK, more than 75% of adults are not meeting the recommendation for vitamin D. And you'll see there's also, this goes down to less than 5%. So you're only green if less than 5% of people are not meeting the recommendation. And you'll see quite a few of these other vitamins listed here are varying shades of orange or yellow, meaning quite a high proportion of people are not meeting the recommendation. So even though people not meeting the recommendations may not show the frank deficiency diseases, although that's not actually true for people with really low vitamin D intake, for example, children, you know, we see rickets in our own hospital in Southampton nowadays, which wasn't seen before. But people who are somewhere between deficiency and having enough, their body may not work optimally. So they may show things like tiredness, fatigue, sleep problems, lack of concentration. They may have weakened immune systems. This is very important for vitamin D. Increased inflammation with increased risk of metabolic disease, heart disease, and so on. Bone loss still occurs with people meeting the vitamin D recommendation, but not actually having quite enough. So osteomalacia, I think, was mentioned before, and other things. So I think this is possibly my last slide. It's just segueing into vitamin D. So we think always about vitamin D and bone, and I think some of the others might touch on that. But vitamin D has many, many biological effects that go beyond helping us build and maintain bones. Very important in muscle strength and muscle function, as we've already heard and we'll hear again. Important in how our blood vessels work, how our kidneys work. Vitamin D helps us control blood pressure. And importantly on this side, I think these are things which are not widely known, but actually are quite well described in the literature. Vitamin D contributes to metabolic homeostasis, supports our immune system, and helps control inflammation. So on the right is simple pathway of the synthesis of the active form of vitamin D. So this is quite a complicated pathway. UV irradiation produces a precursor of vitamin D. That's converted in the liver to 25-hydroxy vitamin D. That's converted in the kidney to 1,25-dihydroxy vitamin D. 1,25-dihydroxy vitamin D is actually the active form. The highest concentration in the blood is actually the 25-hydroxy vitamin D. That's how we normally measure vitamin D status. Sunlight seems not to be enough to give us optimal amounts of vitamin D in our bloodstream. And that, of course, varies in different people. It's affected by skin coloration. Obviously, it's affected by covering up the skin. It's also affected by aging. It's affected by sunscreen use, all sorts of things. So there's lots of factors that influence these early stages. Dietary forms and supplements give us this precursor normally, and that can be used by the body to make the active form. So this is a sort of scheme that people often show, where if you have deficiency of vitamin D, so this is 25-hydroxy vitamin D concentrations in the blood, that will cause rickets in children, osteomalacia in adults. Then you have, this has slipped a bit, but most, well, some people say normal should be above 75. There's a little bit of debate about exactly these cutoffs. And you have this area of insufficiency, which is between deficiency and between normal, and you have a need for supplementation here. So supplements can take deficient people into insufficiency and can take insufficient people into normality. And this is just data from middle-aged white people in the UK. The average concentration in the wintertime is 41, and the average concentration in the summertime is 60. So these are both way below normal. So the general population would benefit from supplementation in exactly the way that Sylvia mentioned. Thanks so much.
Can I just ask you, Professor Calder, before you go, I mean, how worried should we be though? Because you're giving these statistics sound bad, and you're saying rickets in a way that you weren't in recent times.
Yeah.
How worried should we be?
So, I mean, that's a particular case. So if you talk to the hospital doctors that deal with pediatric bone disease, they are worried because these doctors will tell you, you know, 15 years ago, rickets was unheard of in our hospital. Now I'm seeing rickets, you know, weekly. Part of that is because of the changing makeup of the population. So that's one thing. But I think the other thing is, you know, until COVID came along, which is infectious disease, we were focused very much on the non-communicable diseases of aging, like heart disease, cancer, cognitive decline, and so on. Musculoskeletal decline and aging. And vitamin D is very important to mitigate all of those things. So I think it's part of the mix of things we should be concerned about for general health in the population. Layer on top of that, it's very important for immune support. So for things like COVID, flu, what have you, it's also something to be focusing on.
Okay, thank you very much indeed. So you mentioned musculoskeletal issues because Professor Jean-Yves Regenster, he's from the Division of Epidemiology, Public Health and Health Economics in the University of Liège in Belgium, and also director of the WHO Collaborating Center for Epidemiology of Musculoskeletal Health and Aging. So the crucial aspect of vitamin D3 for the musculoskeletal system and also immunity. Tell us more.
Thank you very much. First of all, I would like to thank IBSA for giving me the opportunity of participating in such a prestigious panel. Her few conflict of interest. Make it very simple. Vitamin D can come from the food, or it can come, as it was said, from sunshine exposure to the skin. It has to be metabolized in the kidney. It has to be metabolized in the liver. At that time, we have an active product, and in the musculoskeletal field, it acts to keep calcium at an appropriate level within the blood, as well as within the bone. That's what you see here. Animal origin, sunshine, plant origin, kidney, liver, and here, everything is done to have enough calcium in the blood and enough calcium in the skeleton. Musculoskeletal health mean muscle sarcopenia, bone osteoporosis, joint osteoarthritis. Regarding the muscle, you see that vitamin D increases muscle strength. That's what we need in elderly. There's a wasting of muscle strength over time, and vitamin D prevents muscle wasting. At the level of the bone osteoporosis, vitamin D reduces the risk of hip fracture. Vitamin D reduces the risk of any fractures, but only when it's combined with calcium. So for an effect on the bone, you need to combine calcium and vitamin D. So if we make a summary of that and we look at the effect of vitamin D on the risk of sarcopenia, falls, and bone fracture, it looks complicated. It's not. Vitamin D acts on the quality of the muscle, which means less fall. At the same time, vitamin D acts on the quality of the bone, which means a stronger bone quality. So less fall and a better bone means less fracture. But when the fracture occurs, vitamin D also acts in order to improve fracture repair and to improve the muscle for rehabilitation. So that every single step of the fracture process, before and after, vitamin D is needed. Osteoarthritis. The effect of vitamin D supplementation is less clear in osteoarthritis than in osteoporosis or in sarcopenia. Nevertheless, as you can see, if you look at the percentage of vitamin D deficiency in osteoarthritis and control group, and we're talking about people with a total joint replacement, so a replacement of the knee because of the osteoarthritis, and there is no difference between males and females, you see that there are more people with vitamin D deficiency who undergo a total joint replacement than those who have sufficient level of circulating vitamin D. And that's why in the recommendation of the European Society for Osteoporosis, Osteoarthritis, and Sarcopenia, we recommend the first step of treatment, independently of the risk of fracture, systematically, the first recommendation is optimize calcium and vitamin D status. This is the first step in the management of musculoskeletal disorders. As mentioned by Professor Calder, it has also been suggested that vitamin D may interact with many other body systems, many other processes, including the cardiovascular system, the adaptive immune system, the metabolic system, and the cancer. For all these systems, there are robust preclinical evidence. Not all of them have been confirmed in human beings, but there is a body of evidence suggesting that vitamin D might be helpful against hypertension and cardiovascular mortality, as well as in the modulation of the progression and onset of metabolic syndrome and type 1 diabetes. Just to show you the mortality risk in elderly people, there's a population of women who have either chronically low levels of vitamin D in red or continuously high level of vitamin D in green. And you see that the mortality is greater in the population with chronically low levels of vitamin D compared to continuously high. And this is not related with fracture. It's totally independent of the occurrence of fracture. So independently of the beneficial effect on osteoporosis, having low levels of vitamin D continuously increases the rate of mortality. I was also asked to speak about COVID. There has been, sorry, but I understand you like that slide, but I would like to get the next one. Okay, thank you. Good. There have been an overwhelming number of publications about the effect of vitamin D in COVID. They are rather conflicting. And I think that more than the effect of giving vitamin D to prevent COVID, or the effect of giving vitamin D to cure COVID, is probably, as it was the case for mortality, the circulating levels of vitamin D, which are more important. As you can see here, if you look at the mean level of the mean vitamin D level per country, there is a negative relationship in terms of the COVID mortality or COVID cases. It seems that when the levels of vitamin D are within the normal range, there are less COVID cases and less COVID-related mortality than when the levels of vitamin D are insufficient. And can I have the next? Next, please. Okay. Well, give two at a time. Okay, and that study, which was done in our unit, where the people were hospitalized for COVID, were given 25,000 units of vitamin D on a certain number of days after hospitalization, and that resulted in a decrease of hospital length of stay and a decrease in the duration of supplemental conventional oxygen therapy when the people were at the hospital. Okay, what matters here is that in all parts of the world, including Europe and Italy, there is a clear deficiency of vitamin D. More than half of the population is vitamin D deficient. As mentioned by Professor Calder, we're talking about less than 15 nanomole per liters. So there's a reason why all scientific societies in the world strongly recommend to optimize the intake of vitamin D. And optimizing the intake of vitamin D usually means that you need to take exogenous vitamin D. You have here, as it was shown by Professor Migliaccio, the different foods that may help you to receive vitamin D. If you are prepared to eat 300 grams a day of sardines, or maybe 2 kilograms a day of shiitake mushroom, then you have a chance that you don't need any supplementation. However, there are not that many people who are prepared to do that. And you may remember in the past that the cod liver oil was given to children, which was absolutely like a torture. And also that the children were suggested to go in the sunshine, which probably will make all dermatologists crazy today because of the risk of melanoma. So it's much easier to supplement with exogenous vitamin D. Paper published 2 weeks ago from the American Association of Bone Disease Prevention suggests around 1,000 units a day. And we at SKO have just published last week a new recommendation that also suggests that 1,000 units a day is appropriate in many patients, including those at risk of osteoporosis, on osteoporosis treatment, with fragility fracture, and the elderly people at risk of falling. There is sometimes a need for loading dose, like 25,000 or 50,000 every 4 to 6 weeks. If the patient doesn't like, even with a new formulation, to take something every day, 2,000 every second day is appropriate as well. And in some countries, people prefer to take 25,000 units monthly rather than having 1,000 every day or 2,000 every other day. That's my conclusion. We welcome the press to the World Congress on Osteoporosis and Osteoarthritis in Barcelona, and we hope to see you there in the sunshine to optimize our vitamin D levels. Thank you very much for your attention.
Thank you very much indeed. Can I just remind people watching online, if you've got your questions, please do start to send them in now. Very interesting what you're saying. Yes, we don't want to have to eat sardines and mushrooms. And you talked about muscles, which and the impact on muscles, which of course is going to lead very nicely into our next speaker. And in terms of COVID, I mean, should we all be dosing up on vitamin D as a preventative thing, or is it?
Well, I think that, as it was said, vitamin D is acting on different body systems, and we should, independently of COVID, make sure that people have circulating levels of vitamin D in the appropriate range. I think COVID is an example of one of the numerous diseases which might be affected by low circulating vitamin D. And I think that COVID is just an addition to the reasons why we should make sure that everybody has appropriate circulating levels of vitamin D.
Great. Well, thank you very much indeed. Very interesting indeed. So sport now is a fascinating area because, and Daniel Owens is from the Liverpool John Moores University, from the Research Institute for Sport and Exercise Science. And I think you also have a consultancy where you're dealing with Premier League footballers and elite athletes, who of course also can be deficient in vitamin D. So it's very interesting to hear what's going on in the sports world. Tell us more, Daniel.
Yeah, thanks, Kathy, and thank you, IBSA, for the invite to speak today. I think the rest of the panel have done a really good job actually making my job a lot easier, because a lot of what you've heard sets up what I'm going to talk about in my slides. I'm from Liverpool John Moores University. The sort of main mission of our research group is to optimize health and performance in athletes. Specifically for me, I'm more interested in optimizing athlete health. And we take this approach that we call from the athlete to the lab and back again. So we're working with elite performers, but also doing basic scientific research as well in the lab. One of the major interests for me in terms of athlete health for the past 8 years or so, when I completed my PhD in this area, has been vitamin D. And what I'm going to talk about today is how vitamin D may be implicated in sports performance. And I think we've had some clues to this already from our speakers that we've heard from so far. For me, there are two key areas that vitamin D can be implicated in athletic or sports performance. And I like to think about them as indirect effects first. And you can think about that as, if our vitamin D levels are low, this can negatively impact our immunity, our muscle repair and remodeling, and it can also have an impact on injury as well. And in turn, this will reduce the amount of time the athlete can spend training and competing, so therefore it has an indirect effect on performance. But we also have direct effects as well, and we've already heard that vitamin D may affect muscle function and muscle metabolism, which I'll talk a little bit more about in my following slides. And this, I would say, would have more of a direct effect on performance. We're going to have lower muscle strength and potentially impaired muscle metabolism. So the first question, though, is, are athletes at risk of vitamin D deficiency? We've seen that the rest of the population across Europe definitely are at risk of deficiency. And some work that we did quite a while ago now shows exactly the same thing. So we looked at professional athletes across a number of sports in the summer and the winter months. And what you can see is, if we overlay the current, some suggested guidelines from the US Academy of Medicine about what constitutes vitamin D sufficiency, we can see that most of the athletes that we test fall into these regions of yellow, orange, and red, which would be considered to be insufficient. And as we correctly heard, some people actually argue that this cutoff level might be too low. So if we superimpose the suggested cutoff for sufficiency, we see that most of the athletes that we test in the winter present with vitamin D deficiency. And this clearly is going to then have an impact in one way or another on their adaptation to exercise or their sports performance. So I'll talk a little bit more in detail about where I think vitamin D is really having a role to play in sports performance. And one of my major interests is skeletal muscle, and we do a lot of our research on skeletal muscle. So as we heard before, skeletal muscle is a direct target for vitamin D. And what we mean by that is, firstly, muscle has all the necessary machinery to be able to interact with vitamin D so that it can exert its effects. It's also able to activate vitamin D to its biologically active form. And we also know that thousands of genes are regulated by the vitamin D receptor, which is the mechanism by which vitamin D exerts its effects. So what does that actually mean in terms of a functional outcome then? Well, I've tried to break this down into sort of sub-themes of how vitamin D might have an effect on muscle. The first one is on mitochondrial function, and we know that if our vitamin D levels decline, this can result in impaired mitochondrial function. And this has been a focus of our research group over the past few years to understand whether this also has an impact on how athletes can adapt to training, because mitochondria are central to our energy metabolism and therefore very important to sports performance. Secondly, my PhD work was all focused around vitamin D and muscle repair. And what we were able to show is that in young, healthy individuals with low vitamin D levels, their ability to recover from eccentric damaging exercise is impaired. And then at the cellular level, we were able to demonstrate that the muscle stem cells, which are required to repair muscle and allow it to adapt, they're a direct target for vitamin D and may not function optimally if we don't have enough vitamin D. And finally, recently, some colleagues of ours at John Moores University have also shown in a large cohort of military recruits that low vitamin D levels were associated with poorer physical performance. Another key area for me is keeping our athletes healthy and available to train. And we already heard how important vitamin D might be in regulating the immune system. And what we know in athletes, firstly, is that low vitamin D levels are negatively associated with infection risk. So what we mean by that is the lower your vitamin D, the greater the risk you're going to have of having an infection, particularly upper respiratory tract infections, which are quite common in athletes, particularly when they're training very hard in the winter months. We also know that when athletes get sick and they've got lower vitamin D levels, that the number of days that they will be sick are longer, and the severity of their symptoms as rated by themselves are worse as well. Importantly, though, we need to appreciate that if we correct vitamin D deficiency, we can actually improve our first line defense against sort of invading pathogens. So we know that we can improve our immunity by normalizing our vitamin D levels. So what underpins all of this? Well, firstly, that our immune system, our innate and acquired immune system, they have a requirement for vitamin D. So if we don't have enough, it's not going to function as it needs to. And in real terms for the athlete, what that might mean is that if they have an increased risk of infection, that means they have fewer days at which they can train. They're less available for selection, and this is going to have an effect on their performance. So I'll summarize with a few key points and finish on what I think is the most important thing for us to think about with vitamin D and athletic performance. So we saw that vitamin D can affect sports performance both directly and indirectly. We saw that studies show in athletes that they do present quite frequently with low vitamin D status, particularly during the winter. We see decrements in muscle function and muscle metabolism when our vitamin D is low. We might have impaired recovery and increased susceptibility to illness when we have low vitamin D levels. And the most important point for me is that maintaining adequate vitamin D levels is key for our sports performance. And as we've heard already, this is going to require supplementation. So novel, innovative ways that we can normalize our vitamin D levels are absolutely crucial for making sure that our athletes have an optimal vitamin D status, let's say, for the whole year round. So thank you very much for your attention, and I look forward to taking questions.
Thank you very much indeed. Daniel, just before I open for questions, I just wanted to ask you about, you talk about the importance of supplementation. What about this particular format of supplement for an athlete? What do you reckon? I mean, this is not on the market in the UK yet, I don't think, is it?
Yeah, that's true. I think for this particular formulation, there's definitely a market for that in the sports world. So with the athletes that we work with, we've performed some qualitative studies to look at what are the barriers to actually being able to implement what we think is best practice. So the right dose, the right frequency, and so on and so forth. And one of the things that comes up always is the compliance of the athletes. So when we're working with athletes, we might have a team of 20 players, let's say, and managing a squad of that size relies on some autonomy. It requires on them doing what we actually tell them to do, even if it's laid out for them. They don't always do what you ask. But one of the reasons that they don't always take the vitamin D is because they don't like to swallow pills. So having an alternative approach that's effective, where we have good absorption rates, is really key. So I do see an opportunity for that with the type of population that I work with. Yeah.
Need to get them out to the World Cup squads in
Yeah.
Qatar.
Yeah.
Do we have any questions from the floor or from our online viewers? Yes, we've got something from online here. Does IBSA envision producing further hormonal medications in the form of oral biodispersible films, such as calcitrol, thyroid hormone, or hydrocortisone? Tiziano, you've got your microphone there? Yeah.
Thank you for the question. Some trials are ongoing because we are trying with some other compounds or hormones to be put inside this particular platform. So some R&D are in progress, and we are studying mostly the stability of the different hormones.
Are some
So-
compounds more tricky to put into this
Yeah,
format?
some of them are more tricky. They are tricky in general, so they are tricky in many other forms. And of course, we are studying for example, the suitability of this platform in order to be or to have a stable product for the time, to have a good bioavailability and so on. So some work are in progress.
Thank you. Do we have any questions in the room? No, I of course will always find some questions, so don't worry, you're not going home yet. Well, I mean, I was just interested to know that if we're talking about supplementation, how quickly does it take for a supplement to take effect? And Professor Calder, perhaps you could answer this question. I mean, do we see results relatively quickly?
Yeah, so I'll answer with regard to vitamin D, because that's what most people are interested in today. So you can measure 25 hydroxy vitamin D levels in people's blood. As I mentioned, that's the status marker. So if people start taking a vitamin D supplement daily, you can actually measure an increase in 25 hydroxy vitamin D in a matter of days, okay? But what will happen is eventually the person will get to a new steady state level that will be maintained. And that takes a period typically of weeks to a few months. So the levels go up gradually and then they get to a new plateau, okay? So that's the biochemical measurement of status. And several of us have mentioned there's a relationship between status and biological effect, and there's a relationship between biological effect and health outcome. So, I mean, maybe others can answer how quickly you might see an effect on muscle, for example.
Professor Register.
It's probably rather difficult to measure the clinically relevant effect, the duration of it, but I was just to echo what Professor Calder said, and we should not hesitate when there is a severe deficiency to use what's called a loading dose, like 25,000 units or 50,000 units during 4 to 6 weeks, to make sure that it doesn't take too long to recover from that very low level. And as it was said, then in a couple of days, you will see an increase, but to reach a steady state, we're talking about probably 6 weeks to 2 months now. When it will really impact the global metabolism is very hard to say, in my opinion.
Yeah, but I think just to come back, so human trials usually are of the period of somewhere between 3 and 12 months, because that's sort of logistically achievable. And there are trials on a lot of the outcomes we've all mentioned today of months duration that show benefits, like the studies you showed around musculoskeletal, for example. So I think you get a translation into a clinically relevant or physiological outcome within some months, providing the doses reaching what you want it to reach.
Yeah. You will probably see some biological markers like serum PDH, parathyroid hormone decreasing in 2 or 3 weeks. But that's what we call a surrogate marker, an intermediate marker. To see an increase in bone strength, it will probably take a few months. A reduction of fractures may take even longer. So it depends what is the marker that you want to see. But globally speaking, it's clear when you have a patient with a severe vitamin D deficiency, it has to be corrected. And in this case, a loading dose 4 to 6 weeks is appropriate, and then you switch to the daily administration of the dose we all mentioned and all agreed upon.
There's a question here from Maria Rita Montebelli. How about calcium supplements to take together with vitamin D? How much calcium per day? Who would be the Professor Migliaccio?
Yes, as Professor Register has already mentioned, calcium and vitamin D meet at the same time. We cannot forget calcium if we talk about vitamin D and vice versa. We have to check with our patients how much calcium they take with the food. And then I just remind you that the bioavailability of a specific nutrient might be not sufficient. So usually we suggest to introduce, depending on the age, at least 1 gram a day in the fragile population. And then the dose could be somehow individualized, because we have to remember that when you talk even about vitamin D, we have to talk about individualization of other supplementation therapy and so on. So, but 1 gram, 1.2 in postmenopausal women is what is recommended.
Daniel was saying that athletes particularly don't like taking pills, and that he thinks the compliance will be better with athletes. What about in the general population? Do you think that this sort of format is going to be useful?
I think it's going to be very useful, because compliance for this type of supplements, calcium, vitamin D, is not so high. So improving the way of administration is obviously one important point to optimize compliance of the people, either subject, patients, or whoever, and then optimize the good health of an individual.
If I just may, 1 gram of calcium is 1 liter of milk and 3 yogurt, which is not much easier to eat than 2 kilograms of mushrooms or 400 grams.
It goes together. They go together.
So that's why, but you could just be wondering, why do they recommend to take pills? I mean, we live in a world now where the green wave or the green terrorism is taking more and more power. So you might be thinking they're completely outdated, suggesting to take pills, tablets, film, whatever. It's just because it's very hard to receive the appropriate amount of calcium and vitamin D through the food and daily and the dairy products.
Yeah, and if I can add to what Professor Register just mentioned, is that calcium is contained especially in milk and milk products. However, many people believe that the calcium can be also assumed with introduced with the green and vegetables. However, just remember, since we talk about bioavailability, that in those specific food there are some nutrients like oxalate and phytate, which interfere with absorption of calcium. So unless we want a liter of milk or 3 yogurts, Parmesan cheese, and so on, we might need the supplementation.
1 liter of milk, 2 kilos of mushrooms, 5 kilos of broccolis, 600 grams of sardines, and you don't need any pill every day. And you take 20 kilos in 3 months.
Yeah, this is a really, really good discussion. And of course, Sylvia is right that if you're targeting bone, you have to combine vitamin D and calcium. But we have also been talking about a lot of other targets Correct. For vitamin D where the effects are not related to calcium homeostasis. So I think it would be, whilst you're absolutely correct, it would be wrong to go away with the idea that if you want to give vitamin D, you also have to give quite a substantial amount of calcium as a supplement.
Yeah, it's true for the musculoskeletal health, and then nothing.
Yeah.
Check, there are no more questions. Yes, we have a question here.
Hi.
If you could tell us where you're from, please. The microphone is on.
It's on.
It's okay.
Okay. Mauro Bodrini from Italy, Made in News, Italian Press Agency. Professor Register, how is possible, What do you think about quality of life in a patient with osteoporosis, osteoarthritis, and above all, sarcopenia? And how a daily vitamin D supplementation could improve this quality of life?
Okay, well, it's a slightly different, but globally speaking, osteoporosis and sarcopenia is what we call chronic silent disorders, which means that usually the patient doesn't know that he or she is osteoporotic or sarcopenic until a clinically relevant event occurs, a fracture, a fall, an hospitalization, whatever. So what is important is that we have specific tools to assess the quality of life in osteoporosis and in sarcopenia, and they are extremely sensitive to change, which means that when there is a better bone, when there is a better muscle, there is a reduction of the clinically relevant event, which means that if there are less fracture, if there are less falls, the patient will feel better, will be able to cope with daily activities, will be able to walk his or her pet, will be able to spend the afternoon with grandchildren, and that will make the difference compared to someone who will be unable just to get out of the bed, will be unable to walk, will be unable to make 100 yards to go to the garden. So that's really where that happens. In osteoarthritis is a little more subtle because the quality of life there is related to symptoms, which means mainly pain, stiffness, and related features like crepitus and things like that. So there you will probably see a little quicker the improvement in the quality of life because it could be in a few days. But as I mentioned, there are very few studies today which shows that vitamin D is improving the symptoms of osteoarthritis. It's more the circulating levels. You know, you have two things. You can have someone who is improved because you give something to that person, and there is a direct effect improving. That's what happens if you give vitamin D to someone sarcopenic. You will improve muscle strength. It's also true for the younger individuals. And then you will see an effect because they can do plenty of things. They can stand from the chair. That's what I would call a direct effect. And then in other diseases like osteoarthritis, it's more the global circulating levels over a longer period of time, what we call the exposure to vitamin D deficiency, which is harmful and which will, at the end of the day, contribute to the progression of the disease and the decrease in quality of life.
Thank you very much indeed for that. Yes, a question there.
Hi, everyone. Donatella Romani from Italy. Two questions. First, from Dr. Fossati. Usually we take vitamin D with food. What about new formulation with food, not with food? Second question for everyone. Usually people think that vitamins are children's stuff, and adult, no blood test, no prevention for disease related to vitamin and something like that. So maybe we have to change our culture, create a health literacy to more information, more awareness, something that people could know and change their lifestyle. So not only for children, for every lifelong. Thank you.
Okay, food effect. You have to think that orodispersible film contain vitamin D in a mixture of excipients. These excipients dilute the vitamin D. First effect. The second effect is it is not a solid form. Also, if we see orodispersible film as a solid form, immediately, as well as you put in the mouth, it dissolves. And every product, every active ingredient, every component to be absorbed has to be before disgregated, then dissolved, and then absorbed. So this step is maybe more difficult for tablets because tablets are solid. Orodispersible film is a solid, but immediately became liquid. Became liquid means vitamin D dissolve immediately in the mouth, and then it is absorbed, maybe partially in the mouth. Of course, the rest of the part or of the portion is absorbed by a gastrointestinal tract, and so the food effect or the effect of the food of regarding the bioavailability that is seen with other forms is not seen with the oral dispersible film. So oral dispersible film can be taken with or without food.
And what about the question of health literacy? Who would like to take that? I mean, Professor Calder, do you have views on that?
Yeah, I mean, this is a really good question, I think. So we know in our population, a certain number of people use supplements regularly. I mean, I think in Europe, it's sort of probably a modest number. So there are people who might be legitimately needing supplements who are doing that, but supplements are not, I think, I mean, others could argue with me, I don't think they're mainstream. And it's probably because most, I mean, as you say, most people are not really thinking about their long-term health. I think COVID, we keep coming back to COVID. I think COVID has sort of been a bit of a wake-up call for people that they might be at risk of disease when they hadn't really thought about it before. It hadn't touched them and it hadn't touched their families. I mean, that's an infectious disease and, you know, it's going away, I think. So I think, you know, maybe part of your role is working with people like us to give evidence-based information. And it's quite clear that across Europe, there are a lot of people who have insufficient intakes of vitamins and some minerals, which we haven't talked about, and some other essential nutrients like omega-3 fatty acids that I'm very interested in. So I think, you know, working together, we can create something that can help a bit. And people can try to address some of these things through dietary change. And some people will be willing to do that and might even achieve it. But failing that, people always ask me, do I think supplements are necessary? They seem to be necessary to meet gaps in people who are unable to eat the sort of diets that maybe they should. I think the other thing is this is right across the life course. So it's not just older people, it's also middle-aged adults, it's young adults, it is children. So it is a life course thing.
Can I bring Daniel in? Because, I mean, you're saying that people are not necessarily thinking about their health. Elite athletes do think about their health, but would you say they're still not, you said they don't like taking pills. Is there still in your world a reluctance to take supplements?
Actually, we kind of have the opposite problem in a way. So I'm going to give another perspective, which is that with the sort of health and let's say wellness, the gym goers and even athletes in that space, if they think a little bit of something is good, then they think a lot of it's going to be great. And so the same message applies that good reporting, working with credible sources to get the correct information about how much you need is essential, whether you're someone who doesn't believe you need it or whether you're someone who believes you need it, so you take 10 times more than what you actually need. So I think literacy in the area is crucial. But just for the elite athlete population, it's probably the flip side of the coin.
Because what I mean, one of the key things when you talk about the importance of vitamin D3, it doesn't actually improve performance in an athlete, does it? It just brings back their muscles or tissues to what they were. Is that correct?
Yeah, I think when you think about performance, an athletic performance, you need to break it down into all its components. And athletic performance is never really the product of one trait. It's a collection of different things. And so that's why I sort of broke it down in the way that I did, is that there are a number of components of performance that can be affected by low vitamin D status. So you're absolutely right. It's affecting a number of key areas that ultimately have an impact on performance.
If I may,
Yes.
in elderly subjects, the best way to improve what they call the performance, which obviously has another meaning than in athletes, like the gait speed, the balance, the capacity to raise from a chair, the best way to improve is a combination of proteins, physical exercise, and vitamin D, resistance exercise and vitamin D. And then with the test, which I use to assess performance in elderly subjects, which are, as I said, nothing related to what my colleague is doing with his athletes, clearly the combination of the three provides a benefit.
Do we have any more questions from the room or online? No, not at the moment. So from IBSA's point of view, Tiziano, where do you go next with this this platform? You call it a platform. I call it a film. I mean, you know, where do you see will other vitamins also be put into this format?
Yeah, we see other products, including vitamins or other. This is or dispersible film or FilmTec is a relatively new technique because it was born 20-25 years ago in general, but with our basis based on maltodextrin, that is this highly very soluble product is relatively new because it was the first trials were about 15 years ago. Then thanks to the IBSA scientist, it was bring to the industrialization process. That is a main issue also for a pharmaceutical company. So now we know we have not only one product, not only a basis for the vitamins, we have a full platform. We call platform, and of course we are studying some other components to put inside, including vitamins, metals, or some other components that has to be to be taken day by day. Then it is important to me also the psychological point of view. It is not a pill. It is not a tablet. So a film helps also to mentally take something. This improve what I call compliance of the patient. So we are thinking about this specific need of the patient.
Just check there aren't any more questions in the room before I carry on with asking a question. But we talk about as if it's somehow the individual's responsibility a lot here. We're saying about what people think and their own decisions. But what about the medical community? What role should they be playing, or what changes could there be, or government roles? If we're talking about 75% of people who are actually deficient in a vitamin, it sounds actually like a really important medical issue. Should more be being done elsewhere? Good.
Well, I think that if I go back to my field of the musculoskeletal health, we need to be backed by a major organization. We are currently working with the World Health Organization on a 5-year plan to reintroduce the bone and muscle disease on their map to be recognized as an important part of what they call the global burden of disease. And by having more and more support from that type of organization, it's a message that can be conveyed to the payers, to the healthcare authorities, for instance, to have vitamin D reimbursed. I mean, it's very difficult in many countries to convince the authorities of having calcium and vitamin D taken care of. While all the health economic studies suggest that knowing that vitamin D and calcium have an extremely reasonable price on average, that would be cost beneficial. But that's something that has to be done. You know, the cascade is always the same. Come from big organization like WHO, come to the Ministry of Health, go to the healthcare professionals who are in charge of prescription and are convinced because it's paid for, and then convince the people. And you all have an important role to play there, because usually the health authorities listen a lot to you, more than they do when they listen to us. So it's, as it was said by, I don't remember whom, I think Dr. Calder, it's a teamwork here. We need your support. We are there to help you, to provide you some scientific evidence. That's our role. But then convincing the authorities that there is something to be done today and not in 20 years, that's more your role than ours.
Yeah, I think those are really important points. And what's clear is the medical specialists in the area of musculoskeletal, as you mentioned, they make recommendations, they make guidelines, which fellow clinicians can choose to follow or not. But in the population, so that's for particular clinical scenarios. In the population, of course, it's governments that have the responsibility for setting recommendations and so on. And I don't know the recommendations for vitamin D by the governments in continental Europe, but in the UK, our government changed the recommendation relatively recently because the recommendation was for older people to have vitamin D supplement daily, and they changed the recommendation to everyone. So the UK government recommendation is that everyone takes a vitamin D supplement. But then you come to the other point that we've discussed, is because that's the recommendation doesn't mean that all 70 million people in the UK follow it. Okay, so that's where, so I mean, you know, I'm sure most people don't even know the government recommends that they take a vitamin D supplement. So again, we need this joining up of things. And in the discussion, I thought of something else which I think is relevant. So when people have talked about sources of vitamin D today, they've mentioned sardines, they've mentioned milk, and eggs was on the slides. These are all animal products. And those are the richest sources of vitamin D, as we heard. You can't eat enough mushrooms to get enough vitamin D2. And I think, you know, people's dietary choices are their prerogative. If they choose to adhere to a vegetarian or a vegan diet, that's up to them. But those people are at greater risk of insufficient intake of vitamin D and a whole lot of other things than people who eat animal products. And there are increasing numbers of those individuals in our population because that's become a choice. And in the UK, we know that some of the worst dietary insufficiencies and deficiencies are in adolescents, and they're going to be the next round of parents. So, you know, these are big problems emerging in our societies as people make different lifestyle choices. And again, you know, no one ever really sort of talks about that.
So supplementation is key then.
So vitamin K, which I think I mentioned once in passing, but that wasn't our focus today. So people recommend that if you're a vegetarian or vegan, you should take vitamin K supplements. It's as simple as that, because vitamin K only comes from animal foods. And it maybe should also be an additional point that vitamin D would be another one for people to take seriously.
I'm so happy to hear that, because we have been for many years raising concerns about the vegan diet in our field. If there is one consensus in the field, is that vegan, I'm not talking about vegetarian, if they eat cheese and eggs, that's okay. But I'm talking about vegan, they have a 30% increase in the risk of fractures because, as it was mentioned, all the deficits which are linked. If you're vegan and you're ready to eat one big box of different supplements, why not? But if most of the vegan don't take many supplements, and in osteoporosis, the risk of decrease in risk for fracture is 30%. So it's really a dangerous diet, even if highly fashionable today for different reasons we don't have time to elaborate on.
Well, thank you very much indeed to everybody, to you here, to everybody online, for all your thoughts. I'm going to go straight away and take my vitamin D. I'm going to start taking it daily. I promise, I promise. We are going to conclude with a short video, and then obviously if you'd like to talk individually to any of our speakers who don't have to rush off, I think then they would be very happy to talk to you. Thank you.